Alright, so if you have my notifications turned on, you got the email that I'm live or whatever it might have been, you saw the thumbnail and you're seeing this face now. So COVID-19, right? This is like the most viral topic literally that everyone's talking about ever since December 30th when this man, Dr. Wenlieng, went ahead and courageously just spoke about it from China. So yeah, we all know it originated in Wuhan, China. A lot of it had to do with animal trade, right? And there's a bunch of different animal names that are being thrown around. A lot of theories going around, but this was the man that initially came out and went ahead, regardless of whatever China's government and system allows, he went ahead and just let the world know, hey, something's happening and it's scary, be ready. It was a big step he took. It was such a big step he took that the country, instantly labeled him as a whistleblower. Obviously, his face and name were already out there, so there was no hiding that because he put that out there himself. And unfortunately, he actually ended up dying too. He got sick. He was an ophthalmologist there. He got sick from the same coronavirus, and then at the age of just 33, he died on February 7th, 2020, not too long ago, right? And the world, didn't really take his warning too seriously. We didn't really do much with it. China obviously didn't treat him right about it. And yeah, sure, you apologized and you did whatever they did. They tried to make up for wrongly calling him a whistleblower and trying to shut him up. Nothing came out of it. So that was that. Not much came out of it at all. What is happening now, right? So today, a lot of things are messed up for so many people. I mean, beginning of this week, actually, just the beginning of this week on the 16th of March, Prometric is closed, right? So anyone that was taking their test from between March 16th to their current tentative date of April 10th is completely screwed over. There's nothing you can do. You can't take your step 1, you can't take your step 2 CK, and then CS is closed for multiple reasons. I mean, a lot of you have to take it on American soil for the most part. So since people can't even travel, you can't take CS, right? And everyone that would be applying for residency this coming September, if they're not done with those tests, then at this time, you just aren't going to be able to do anything about it. We're just waiting to hear from it. So I'll get to that when we get there. Other things I'm going to talk about is the fact that there is a possible treatment that's out there right now, right? So it's been working pretty well in China. It's called remdesivir. It's also one of the tabs I have right here. Montefiore Hospital, the one that I work at as a clinical trial coordinator, is actually running trials, and I volunteered to actually be a part of it. So that's something that's going to be coming up as well. And there's a lot happening that you and I might not have thought of, but is affecting many other people throughout the world. So as I keep talking, I have this outline of stuff I want to discuss. Feel free to ask your questions like Fadi just asked, why do I think they were trying to shut him up? I'll definitely talk about that. And then the tabs that I show here are obviously, other good resources that you can go ahead and reach out to. No one video will be good enough to encompass everything about coronavirus ever, because it's still developing. Every second and every day, brand new updates are coming out about the spread, the numbers, right? There are apps out there, how many people have gotten disease, how many have died. And this is all going to not just impact every single person every day, but it's also going to impact a lot of you guys that are taking your step 1 in the future at some point, right? So at the base, for the most part, we all know coronaviruses. Coronaviruses are not exactly the newest thing, right? They've been a part of first aid for a very long time. So if you go into first aid and you look at your RNA viruses, it's one of your positive single-stranded linear RNA viruses. And Sketchy Micro had this image for it when they were teaching it, right? It causes the common cold. So many people have at some point been exposed to a coronavirus, and it depends on which one you were exposed to. And they tell you in this image, nicely that it is obviously helical. The crown is there to remind you the coronavirus stuff. There was many more things to this. The other diseases are also related, right? So we have SARS and MERS, and MERS, not many people in America might have really known much about, but SARS was definitely a huge scare in 2002. Right? In 2002, SARS, a coronavirus, had become a major issue, and now, after much research, at that time we were like, not when it first happened, but now we know for sure that it was something that came from bats, which then went to civets, something that looks like a squirrel or a cat, and then it was able to come into humans. So, of course, yes, coronavirus does cause the common cold, but that's the human version of the coronavirus. It's pretty benign. Common cold happens to everyone at some point, multiple times a year, and then it goes away. And you don't have to do anything. It's just symptomatic treatment, and you'll be just fine. The animal versions, though, being that this is a single-stranded RNA virus, the animal versions are very, very mutated. Now, mutated viruses, as we've all seen at some point, cause many other issues that you don't really want to try messing around with, right? How do these things work? So, in case you're still not done studying this stuff, there are two types of RNA viruses. They could be positive or negative. The positive RNA virus is just like a messenger RNA, so it can go ahead and use your cell materials, right, your ribosomes and stuff, to go ahead and make proteins. And proteins can be any kind of protein, an enzyme, something that messes up your enzymes, or something that directly causes disease, whatever it might be. And then negative RNA viruses have to be converted to a positive, and then you can go ahead and get more symptoms from that. But coronavirus itself is a positive single-stranded RNA virus. And being that it's an RNA virus, right, the whole concept of mutation is much more possible here. Unlike DNA, which does have error checking and fixing even, right, mismatch repair and whatever other repair mechanisms, RNA doesn't necessarily have any way of fixing it, right? So you can get all kinds of tiny changes, whether it be one letter or a set of letters in that entire RNA fixture, and you just start making a whole different protein now. The MERS one, that one, Middle Eastern Respiratory Syndrome, that one was something that occurred in 2012. It went from bats to camels, right, which is fitting, Middle Eastern, and then from camels was able to move on to humans. And both of those had quite the fatality. A lot of people died, and whether it's just one person died, or 1,000, or 10,000, you don't want to be that one person. So it's a big deal that anyone died. Right now with the coronavirus, the fatality is increasing every second. If you're watching any apps that you use, or even the news, there's literally a ticker showing you how many people are dying. And the saddest deaths that you can see are in Italy, right, where there are circulating pictures of literally army trucks and whatnot carrying away coffins of dead bodies because there's no space to literally put it away, right? These dead bodies are accumulating so quickly that there's no way to actually orchestrate how to deal with it, right? So that's just stuff that's happening. Single-stranded RNA virus, right? Not something brand new. So of course you can imagine that in future versions of first aid, right here, it will have COVID-19, which is also now being called SARS-CoV-2, right? SARS for the severe acute respiratory syndrome, coronavirus 2. That's the official name WHO has given it because it's so similar to the whole SARS thing, and it's all part of coronavirus family of viruses, and it's pretty problematic. What is it causing? So to someone like many of us that are around 30, between 20 and 40, under 40, it won't really cause much at all. For example, I myself, because I am in the hospital almost every other day, currently, I don't have to go in every day, it is very likely that some point after stepping out of my door and before I return to my door, I picked up the virus, right? It's very, very plausible. But I don't have to exhibit any symptoms. And whether or not you exhibit symptoms of a virus really depends on the viral load, something that we're all very familiar with when it comes to like HIV and AIDS treatment, right? We look at the viral load in a patient to determine whether it's HIV or AIDS. That's the big differentiation we can make in an immunocompromised HIV patient. For some reason, again, we don't know everything about COVID. For some reason, younger individuals don't really tend to have a very high viral load. So we might not even have the dry cough or sneezing or anything at all. The people that are being affected the most are people that are already immunocompromised, people that are already having the symptoms that the disease itself would cause. So if you already have respiratory distress from anything, whether it be COPD, heavy smoking, if you have alpha-1 antitrypsin deficiency, any kind of disorder that really messes up your lungs, you're at much more of a risk to then develop the symptoms that COVID can cause and then eventually die from it. So what are the symptoms it can cause? So all over the internet, you're seeing all kinds of things, and the majority of it is pretty true. The fever is the main one you want to catch, right? Fever is always important in any question you do in first aid, in UWorld, wherever it be. If a patient has fever, it's almost 99% likely that the patient is someone who has an infection with either a virus, bacteria, whatever. So that's the first thing we're all checking for, right? Even when I walk into work at Montefiore Hospital, there's nurses stationed at all the entrances, and they check for fever, and they ask you, have you had any symptoms of a flu or a cold, right? Because it's very similar kind of symptomology. And that's the starting point, because at the moment we don't have the diagnostic kits. So what is the diagnosis? What are symptoms that you're looking out for? Diagnosis is generally, because this is a RNA virus, you would need a reverse transcription mechanism. So reverse transcription PCR, RT-PCR, will be the quickest way to actually diagnose it. And even that isn't so quick, depending on the actual PCR mechanism and depending on how many kits are even available, being that this is a recent pandemic. A lot of this isn't even available, right? There might be a way to make the RT-PCR kit, but not everywhere do we actually have the RT-PCR kit. And then on top of that, how many people are we going to actually screen, right? There are too many people to check, and if you leave it to just use the RT-PCR kit for people who are actually presenting with symptoms, you most likely don't even need the kit at that point. It would be more so for not just screening, but confirming the diagnosis. Now, if we, think about why this is the case, well, it's a business, right? Everything is a business. Unfortunately, when outbreaks like this happen, whether it be one of the many coronaviruses we've talked about, or even Ebola, which was not a coronavirus at all, when any of these things happen, the only thing that really occurs in terms of business is that stock market prices go down, everything starts losing business, people are told to stay in the best they can, avoid contact with stuff, but no one really invests into medicine in that way, right? So we don't really invest into truly accelerating making vaccines, truly accelerating getting medications out, because all of this is very sensitive stuff. You can't just make a medication and start feeding it to people. You don't want to be the next thalidomide, right? Where you made a medication for morning sickness, but then kids were all being born with their limbs in the wrong places. Clinical trials take a long time. They have various phases to it, of course, right? We've seen in our books phase 1, 2, 3, and 4. It's not that easy. This takes a year at best. And that's assuming you're going to be able to get people to consent, right? And consent for the right reasons, because you have to understand there should be never anything that is pushing you to sign an informed consent. Now, if you're really sick and you really think you have the coronavirus, you might be motivated more to actually sign up for coronavirus clinical trials because you think it'll save you, and that's ethically not exactly the best way to get an informed consent. An informed consent should be based off of completely nothing at all. You want to do it and you think it might help. That's generally it, not because you truly don't have any other option and whatnot. There's a big ethical aspect to it. So symptomology is huge. And then after that, what happens to the people that kills them? Why are so many people dying, right? This is something that many, even celebrities, have gotten backlash for because, of course, everyone's sitting at home. So now the only thing you can do is be a at-home celebrity. So all the talk show hosts, all the big movie stars, and even popular people that aren't movie stars per se, are streaming live nonstop from either their Instagram, their Facebook, whatever it might be, and talking about stuff. And you have to be very careful no matter who you are, whether you're a small-time, minusculely famous like me, or big-time famous and huge in the world internationally. You have to be very careful what you say, right? These people, a lot of them have come out and say, oh, I can't believe so many people are dying. Is this even real? And that's very insensitive, right? Because you don't know what's actually happening. People are dying. And why is it that people are dying? What are the main things that can be due to infection and then actually lead to death? So we know infection can lead to many things, and one of the big things that this kind of infection that affects the lungs can lead to is acute respiratory distress syndrome, right? That's a very big topic in first aid, and it's a big topic in U World, where all this inflammation causes alveolar insult, you get a leakage of fluids, right? Protein-rich fluid coming out, and then you just can't breathe correctly. You get non-cardiogenic pulmonary edema, right? It's not due to any kind of heart failure. It's literally because your lungs are not able to function correctly. This can then lead to other things, right? And the two things are interrelated. Either this can lead to sepsis, or sepsis can lead to this, and that's written here too, right? So you have sepsis, aspiration, of course, pneumonia, trauma, any of these things. So the sepsis part, especially what is this notification? YouTube is not receiving enough video. Blah blah blah. Okay, it should be fine. Septic shock, right? So sepsis, then going on, you're gonna go into like crazy levels of shock, and shock is something that not everyone's ready to sustain. Now, it's very rare in 2020. Well, not right now, but I guess up to 2019. Up to 2019, it was very rare to hear that someone died because of ARDS or septic shock. It's not something that really truly kills people unless they're very immunocompromised, they're extremely old, or have a lot of other comorbidities. But shock, right, no matter how it is a huge issue that can really debilitate a human functionally, and then you just can't survive anymore. All of this being put together with the fact that a lot of people are working from home now, a lot of providers are working from home now, hospitals have really gone the wrong way, right? The whole thing about flatten the curve, raise the bar, right? So the curve is the bell curve. You have a lot of people getting infected. You want to flatten that. And then raising the bar is raising how many people are actively available at hospitals to treat patients. This is going the other way around. The bar is not being raised because everyone has to stay home. And the curve is not being flattened because the wrong people are still out, and the wrong people are unfortunately still getting sick. There's a lot of things that get impacted. Not everyone can just sit at home. It's not possible for everyone. Healthcare workers, whether you're a nurse or a doctor, or even if you're just anyone else that has to be at a hospital for it to function correctly, which even includes janitors. These people can't just sit at home. They have to go in and they have to make sure they're safe, they're well, and that they don't circulate the virus even more. Personally, I'm working with cancer patients, right? I'm on the oncology research department. I am the healthiest person that's amongst these people because any of these patients that are coming, they are immunocompromised. So it's a bigger scare for me to go in front of them because I might bring something to them rather than any of these other patients bringing something to me. So the only time I really do have to go in is if I have a patient coming in and I have to give them their pills, which I do without actually going in front of them. I'll just go ahead and tell the pharmacist to dispense it, give him the box, and he goes home. I'll have a phone call with him or her, and it's all good to go. But other than that, clinical trials require a lot of things. You give people new medications, then they have to come back every 2 to 3 weeks. You take their blood draw, right? You check their cancer progression, whether it's getting better, worse, etc. And based off of that, you can go ahead and evaluate whether or not this clinical trial medication is actually helpful. So my job and the job of every other healthcare worker is extremely significant at this kind of stage, right? This is the kind of thing that really requires doctors to be actively doing their part. But unfortunately, many of the actual practicing physicians are above the 40 to 45 year age range, and then on top of that, some of them do have comorbidities, right? Many doctors do smoke, many doctors are diabetic, many doctors do have hypertension or some kind of other lung condition. So they also are refraining from coming into work, right? And that's becoming a problem of like, what can you do? Because it's not even fair to say that they're being selfish. They're not. They have to look out for themselves. If you were in their position, you would too. You would want to stay home and try your best to not come in. Now, there are people out there that need to come in every day. They have chronic conditions, whether it be some kind of skin infection, chronic recently diagnosed heart conditions, recently diagnosed pancreatic conditions. all these patients that just recently got diagnosed when COVID was becoming a quarantining kind of scenario, those patients are totally messed up. They can't do anything. They can't do anything about it. Um, Clinical trials are doing everything they can to figure out what the root cause of this virus being so bad is, and then how we can fix it. So yeah, as Akram is saying, so exactly right now there's a study title. So all clinical trials that are happening all over the world, they are on clinicaltrials.gov, and the name of the medication is this one right here, right? So remdesivir. This isn't a brand new medication, but it was developed by a company that's extremely successful, Gilead, right? Gilead Sciences is a company that also made a medication for treating Ebola and Marburg, which are already in first aid, as well as many of these other ones that are listed here, right? And the coronaviruses. So remdesivir is a medication that was actually recently used in America to treat a patient who had coronavirus. He was on day 11 of his symptoms, and the next day he started recovering. He started getting better. Right? So this medication is extremely promising. But again, you have to justify when you give these kinds of medications to people. You can't just give it to anybody just because they need it, right? We don't know if this is a medication that's safe for everyone. We don't know if this medication has any side effects, right? Not all side effects pop up on everyone, so it might not have shown in this patient, but it might show up in the next one. And then many medications have long-term side effects. So research is something that has multiple phases to really make sure things are going well. Thank you for that updated information right there, Harry. Appreciate that. So research uses, there's a bunch of research on the medication itself already, which is great because it's been happening for a very long time. But this medication, how it works with the new SARS-CoV is a whole different thing. And at my facility, we're going to be doing this research. It's called a multi-center adaptive randomized blinded controlled trial of the safety and efficacy of investigational therapeutics for COVID-19. I know a lot of you were asking about chloroquine and COVID-19. That is still something not many people know about, right? Chloroquine is a very interesting medication. Mainly when you think of chloroquine and any of these queen medications, you think of malaria. Now, how chloroquine has been able to help people that are going through coronavirus infection is still something that's kind of up in the air. People have their theories, and a lot of it does seem very logical, but it's not exactly something that we can talk about and hopefully not be tested on either. This is a medication that you really just think of for malaria, right? It's able to do a lot of things, and it's a very impactful medication, but how it's working in coronavirus is beyond me, and I haven't really seen anything online about its mechanism for helping against this either, right? You can see here, it just blocks detoxification of heme into hemozoin, so that might be something that's relevant for the mechanism of action of COVID-19 whenever we discover that. Heme is accumulating now, and that heme is what's toxic to Plasmodia. It's very unlikely that that same mechanism is what's killing the COVID-19 virus, because the virus isn't alive to begin with, right? It's just protein. So heme being toxic to a protein is a very rare thing. I've never really heard of something like that. So I'm not exactly sure how the chloroquine might be helping someone with COVID-19 infection. So whenever that research goes into place, we'll find out. But more important would be the remdesivir, because it's actually been treating people and it's getting them to get better. And then, of course, this will spark a big medication that the whole world will try to invest into because everyone is impacted. The principal investigator for this research at Montefiore Hospital is Dr. Barry Zingman. I'm going to meet with him on Monday to see if I can get onto this clinical trial too, because we need staff, right? So I signed up for it because why not? It should be something really interesting. And because I'm available, so I want to be a part of it. I know not all the other fellow clinical research trial coordinators that I work with, not all of them are available, right? Many people have kids they have to stay home with. Many people have other responsibilities they have to take care of. Other than streaming with you guys, I work. So I'll make sure that I try to go ahead and do my 2 cents for this. Now, what's truly significant to you guys directly is the whole ECFMG stuff, right? We have no idea what's going to happen when it gets to residency applications this September 15th of 2020. As you can see here, right, it's all closed for 30 days. They're saying there's a tentative April 10th date that it's going to resume from, right here. But this is all up in the air. It's all going to change. You never know what's going to happen. There would be no viable reason to resume all these testing centers and to end the social distancing that we're all trying to do if the virus hasn't been completely eradicated, because it's a virus and it has a pretty high infectivity rate. So it's not a virus that's going from one person to one person. It's almost got like a 1 to 2 kind of ratio. So one person can effectively and very easily send the virus off to 2 people at a time, but very rarely 3. Not like it's not possible for one person to infect 10 people. It's not going to be like that. That one person will really only be able to make enough RNA copies to be able to send it to 2 other individuals who can then later incubate it over a period of 4 days, make more copies of it, and then send it to 2 more people. But that's pretty exponential, right? 2, 4, 8, 16. So that's kind of the rise we've been seeing. That exponential rise is what we're seeing. And if that's not done, if that's not completely eradicated, there will be no reason to start reopening things that allow mass gatherings. So it's very likely that step 1 might not be something you can access even throughout all of April and June until it's finally eradicated. And a lot of people are theorizing that by July we'll have enough of resources, whether it be the medication or testing kits, to completely deal with this, and that the fatalities will start to drop. But at the moment it's not looking like that. Just a couple days ago, I think 2 days ago, here in New York, in Brooklyn, a lot of people were diagnosed to have COVID-19 infection. And if this kind of thing keeps happening, where every other day we're finding out a whole new mass of people have the infection, it's not flattening the curve, right? So the best thing we can do, as everyone else has been saying, is just use your time effectively at home. Very, very important. Yeah, Akram, so what Akram just wrote, that's called the R naught. That's something that I believe Osmosis has great videos on. So if you're trying to really get like full details on Osmosis while keeping it visually appealing and all of that, Osmosis made excellent videos to talk about that. But yeah, the R naught is almost 3. So the R naught is how many people it can go to. So if someone's R naught, if a virus has an R naught of 0, then it can't go to anyone. If it has an R naught of 1, it's one person gives it to one person. R naught of 2 means that one person can give it to 2 people. And coronavirus right now is estimated to have an R naught of about 2.5, not 3 per se. I don't quite know what the 2.5 really means, but it's obviously more than 2. So that's a big problem. It's spreading really, really quickly, and everyone is just getting totally messed up. So what can we do now that we're sitting at home, unable to go take our tests? Well, you could see it as a blessing, first of all. Regardless of how ready you were for the test, not being able to take it right now is not your decision that you're not taking it. It's not like you postponed the test. It's a postponement that's bringing you more time to either relax and recover because you might have been studying really hard, or continue covering topics that you weren't quite yet done looking at, right? Whether it was still going through my first aid mastery playlist or still going through some pathoma, whatever it might be. Maybe you still have some UL questions you want to go over. Keep studying, right? Rest, relax, keep studying. Use your time wisely. You don't want to overeat. You don't want to be stuck sleeping too much. You definitely don't want to chew away all your free time with 8 hours disappearing into Netflix or any other shows, stuff like that. Just keep studying, work out, go for runs. It's okay to step out of your house. No mass gatherings. Just definitely don't want to go into any mass gatherings. You don't want to take mass transit. Obviously the memes of everything is where it's at. So of course, wash your hands, don't sneeze, don't cough. The mask thing is not exactly the most accurate, but if it makes you feel better, go ahead and do so. The N95 mask is the only mask that would really be effective, and it's something that we're all using anytime we're in contact with someone that might even have the coronavirus. So at the moment, what we can look forward to is first making sure that remdesivir, the medication that's been helping quite a few people recover. This medication gets FDA approved to be used to treat people who have the coronavirus infection. Once that starts happening, the number of people that are sick and dying will start decreasing gradually, right? Then we'll see that, okay, things are under control. That control is the biggest thing, right? Because of the lack of control, everyone freaked out. Now Costco, BJ's, and all your local supermarkets are basically drained of any food, water, cereals, etc. that you would really want, right? And that's the fear factor of things. So once this is contained, once the treatments are all kicked in and everything's starting to get a little better, you don't have to worry about that aspect of stuff. And once no one is dying at all anymore, that is when everything will resume normal operation. So as far as residency applications are concerned for September 15, 2020, if things go on the way they are right now, everyone that's done taking all their tests and is ready to apply will probably be able to apply. And those who weren't able to, that's something that ECFMG and USMLE will have to figure out what they want to announce. Whether they'll say you don't need to have step 2 to apply this time around, or whether they'll prolong how soon you could take your step 2 after applying for residency. Because these dates can't be moved around. Obviously, we need doctors, right? So we can't not have a residency holding this year. Of course, a lot of people are coming up with many things, right? So some of them are saying, just take us all. We're done with med school. Whether or not we're done with step 1, 2, whatever, just let us apply. Just take us, because we need doctors desperately all over the world. My personal thought on this is that I think they're going to let people apply for residency without CS at a minimum. That's definitely something that shouldn't be required this year for people to be applying for residency, because CS requires travel and travel is banned. You can't. So without the travel aspect of things, you're never going to be able to take your CS exam. And traveling isn't something you just get up and do the next day. Some people who are taking CS have actual families in these other countries. They can't just leave their kids and wife and just come to America to take CS on a whim. It's not that easy. That might be one thing that USMLE and ECFMG might announce, and then people who have done step 1 and step 2 CK, they'll be able to apply for the test apply for residency and go ahead and match, and maybe they'll be required to do CS sometime before match day, whatever it might be. That's something that we're all obviously eagerly waiting to hear back about. There haven't been any updates recently. And, the best we can do right now is stay home, study, relax, and just keep doing whatever it is that you can do to contain the virus and not spread it, and just stay healthy. Thanks a lot for joining. Feel free to obviously, shoot me an email about anything, leave comments about whatever you're thinking about. And then as things get better and better, because I really hope it doesn't get any worse, we're going to see what's happening. And we're going to figure out what the future holds. And of course, keep doing your research. You really want to make sure you know this stuff, because this is going to be on future NBMEs in no time. It's all going to show up, right? Including the whole chloroquine aspect of things. So, stay informed, and don't be racist, because Trump is out there yelling Chinese virus, and that's pretty fucked up. It is not a Chinese virus, nor do you want to call it Wuhan virus. There's a lot of attacks going on, right? People are shaming other Chinese people that are walking around, even if they're not actually Chinese, but they look Chinese. Whatever it might be, you don't want to be part of that group at all. Do not act like that. That's very inhumane. That's rude, and that's just pure fucked up. That is not how a doctor or any human should be carrying themselves. Right? So let's keep the humanity there, and let's keep studying, and then I'll see you guys later on when I resume regular step 1 streams. Thank you very much for joining.